Choking is a common yet serious medical emergency, particularly among the elderly population residing in aged care facilities. It occurs when an object lodges in the throat or windpipe, obstructing airflow and potentially leading to life-threatening consequences. Understanding the nature of choking hazards and the heightened vulnerability of the elderly is paramount for aged care workers to ensure resident safety and well-being. The elderly are at an increased risk of choking due to age-related physiological changes. These include decreased muscle mass and coordination, affecting swallowing mechanisms. Additionally, dental issues, such as missing teeth or ill-fitting dentures, can impair chewing, increasing the likelihood of larger food particles posing a choking risk. Cognitive decline, prevalent in conditions like dementia, can further exacerbate the risk, as individuals may have difficulty recognizing food or forget to chew properly. Identifying residents at a higher risk of choking is crucial for implementing preventative measures and ensuring prompt intervention when necessary. Several resident-specific factors can significantly elevate the risk of choking, demanding heightened awareness from caregivers. Difficulties in swallowing, known as dysphagia, are common in the elderly and can be caused by stroke, Parkinson's disease, or other neurological conditions. Medical conditions affecting coordination and muscle control, such as stroke or cerebral palsy, can also increase the likelihood of choking. Furthermore, cognitive impairment, as seen in dementia or Alzheimer's disease, poses a substantial risk, as residents may exhibit poor judgment regarding food choices or eating habits. Caregivers should pay close attention to these risk factors to create a safer eating environment. Recognizing the signs of choking is the first step towards providing life-saving assistance. Choking can manifest in two primary forms: partial and complete airway obstruction, each presenting distinct symptoms. Partial airway obstruction occurs when the airway is partially blocked, allowing some air to pass. Individuals experiencing partial airway obstruction may cough forcefully, wheeze, or exhibit noisy breathing. Complete airway obstruction, on the other hand, is a medical emergency requiring immediate intervention. In this case, the airway is entirely blocked, preventing any airflow. Individuals with complete airway obstruction will be unable to speak, cough, or breathe, and their skin may turn bluish, a condition known as cyanosis. Silent aspiration, where food or liquid enters the airway silently without any outward signs, is another dangerous possibility, particularly in individuals with swallowing difficulties. Preventing choking incidents is a top priority in aged care, requiring a multifaceted approach that addresses various aspects of resident care. Dietary modifications play a crucial role in minimizing choking risks, ensuring food is easy to chew and swallow. Caregivers should prioritize soft, moist foods that are cut into small, manageable pieces. Thickened liquids may be necessary for residents with swallowing difficulties to slow down the flow and reduce the risk of aspiration. Proper positioning during meals is equally important. Residents should be sitting upright at a 90-degree angle to facilitate swallowing and prevent food from entering the airway. Adaptive equipment, such as specialized utensils or plates, can further assist residents with limited dexterity or hand tremors, promoting independence and reducing spills. Creating a calm and unhurried mealtime environment allows residents to eat slowly and mindfully, minimizing the risk of choking. Despite preventative measures, choking incidents can still occur, necessitating a swift and effective emergency response. The first step is to assess the situation and determine the severity of the obstruction. If the resident is coughing forcefully and can speak or breathe, encourage them to continue coughing, as this natural reflex can help dislodge the obstruction. However, if the resident is unable to cough or speak and their breathing is compromised, immediate action is required. The Heimlich maneuver, a series of abdominal thrusts, is a life-saving technique used to dislodge objects obstructing the airway. Simultaneously, it is crucial to alert other staff members and call for emergency medical services immediately. Basic life support, or BLS training, is essential for all aged care workers, equipping them with the knowledge and skills to manage choking incidents effectively. The Heimlich maneuver, a cornerstone of BLS, involves standing behind the choking person, wrapping your arms around their waist, and delivering upward thrusts just above the navel. These thrusts increase pressure in the abdomen, forcing air from the lungs to expel the obstruction. In cases where the choking person is unconscious or unable to stand, modifications to the Heimlich maneuver are necessary. For unconscious individuals, chest thrusts, similar to chest compressions in CPR, are performed to dislodge the obstruction. Remember, prompt and accurate execution of BLS techniques can be the difference between life and death in choking emergencies. Following a choking incident, even if the obstruction is successfully cleared, post-incident care is crucial to ensure the resident's well-being and prevent further complications. Firstly, it's essential to monitor the resident's vital signs, such as breathing, pulse, and oxygen saturation, to assess their condition and identify any potential issues. Even if the resident appears stable, seeking medical attention is paramount. A medical professional can assess the resident for any internal injuries or complications that may not be immediately apparent. Thorough documentation of the incident, including the time, date, details of the event, and actions taken, is essential for legal purposes and to inform future care decisions. Finally, the resident's care plan should be reviewed and updated to reflect the choking incident and mitigate future risks. Accurate and detailed documentation is critical in choking incidents, serving both legal and quality improvement purposes. Every incident should be meticulously documented, including the date, time, location, individuals involved, a description of the event, and the actions taken. This documentation serves as a legal record, protecting both the resident and the aged care facility in case of any legal proceedings or investigations. Furthermore, documentation provides valuable insights for internal reviews and quality improvement initiatives. By analyzing incident reports, aged care facilities can identify trends, contributing factors, and areas for improvement in their choking prevention strategies. Compliance with all relevant legal and regulatory guidelines regarding choking prevention and management is non-negotiable, ensuring the safety and well-being of residents under their care. Choking prevention is an ongoing process that requires continuous improvement and adaptation based on experience and best practices. Regular training for all staff members is paramount, ensuring they are equipped with the latest knowledge and skills in choking prevention, identification, and management. These training sessions should be interactive, incorporating practical scenarios, role-playing, and hands-on practice of basic life support techniques. Feedback mechanisms are crucial for identifying areas for improvement. Staff members should be encouraged to report any near misses or potential choking hazards they observe. Regular audits and reviews of choking prevention protocols can help identify any gaps or areas for enhancement. By fostering a culture of continuous learning and improvement, aged care facilities can create a safer environment for their residents. Key takeaways, essential points for aged care workers. Choking is a preventable medical emergency that poses a significant risk to elderly individuals in aged care settings. Understanding the risk factors, recognizing the signs and symptoms, and knowing how to respond swiftly and effectively are crucial for all aged care workers. Implementing preventative measures, such as dietary modifications, proper positioning, and creating a calm mealtime environment, can substantially reduce the incidence of choking. In the event of a choking incident, prompt recognition and action are vital. Basic life support training, including the Heimlich maneuver, empowers caregivers to provide life-saving assistance while waiting for medical professionals. Continuous training, feedback mechanisms, and a commitment to best practices are essential for maintaining a safe and secure environment for elderly residents. Assessing your knowledge. A quick quiz on choking prevention. 1. List 3 resident-specific risk factors for choking. 2. Describe the difference between partial and complete airway obstruction. 3. Outline 3 preventative measures to minimize choking risks. 4. Explain the steps of the Heimlich maneuver. 5. What information should be included in the documentation of a choking incident? If you found this video helpful, please like, share, and subscribe for more essential aged care training videos.